Hello everyone and welcome to sqadia.com. I'm your educator, Dr. Ali Imran, and today's lecture is on thoracic imaging. In this lecture, we'll be studying about non-traumatic chest wall pain. We'll learn about pleuritic pain. We'll learn about how different modalities are used in different setup. Like we'll go about it with examples like which modality to use in a chest wall infection, which modality to use when there is malignancy, what modality to use when there's metastasis, what modality to use when we have a chest wall mass. So we learn about all those modalities, their selection, the choice of it, and why we even choose those. Then we learn about the cardiac disease. We learn that it is due to both the ischemic heart changes and also due to the occlusion. We also learn about the aortic dissection, the ulceration. We learn about the typical cardiac workup, the ECG, echo, cardiac CT, MRI. We learn about the VQ scan and the other perfusion imaging. But most importantly, we learn about the risk assessment studies and modalities like the calcium scoring system. And we'll also learn about the CCTA or the coronary CT arteriogram. Now, this is arteriogram, not angiography. In arteriogram, what we do is we use non-invasive techniques and contrast, and we'll also learn that why this particular method which was used for risk assessment is going mainstream. It is now being used instead of other main conventional cardiac modalities. We'll also learn about the acute chest pain. We'll learn what is an acute chest pain and which modality do you use to diagnose it. We'll learn what is the chronic chest pain and what it is and which modality to use and how to interpret those images. What are the usual suspects for it? What is the most common cause of both the acute and the chronic chest pain? We'll learn about it all in this lecture. Then and last, we'll learn about the congestive heart failure. Now, congestive heart failure, though it is a life-threatening condition, we'll learn that like every doctor should learn that how it must be diagnosed simply on chest x-rays. How it is done, why it is important, we'll learn all about it in this one. On sqadia.com, you can find lectures ranging from anatomy to physiology to biochemistry to radiology. You can find each and every topic relating to your medical education on this website. So please do check out, and thank you so much for watching sqadia.com.